Welcome back to a brand new episode of Private Parts with me, Liv Bentley. This is the podcast where nothing is off limits, and we have got our glorious doctor back this week, Dr. Motox, who's brought a friend.
I have brought a very special person. I've got Mary, who is a fountain of knowledge. Anything I know about skin, anything I've spoken to you guys about on here comes via Mary. So Mary, introduce yourself. Who are you? What do you do?
You're looking very well today.
Thank you so much. I haven't been
Isn't
paid.
he a handsome boy? So my name is Mary Keltai. I'm a consultant pharmacist prescriber, and forgive my voice because I've been giving lectures all this week.
She's a secret smoker.
And I am an international trainer for Obagi Medical as well. So I travel a lot.
Which we love. Products we've also spoken about.
Yeah, we
on here.
have. We have.
This is where I get my knowledge from about all things Obagi and just generally skincare.
And if he's having a bad day, he'll give me a call.
Bitch about his patients, probably me being me. Welcome to Private Parts. This is my favourite one because Mo tells me everything I should and shouldn't do to my skin, and smoking Marlboro Golds is obviously one of them.
What are your thoughts on smoking, Mary?
On smoking, well, do you know the problem with smoking? And excuse me, I have been doing presentations for this last week. So this morning I woke up and there was not a peep out of me. So as I said to Mo, ask me to do a beep.
It's not coming
So
out.
look
Not
over.
happening.
Yes, smoking is very detrimental towards your blood supply. So for example, a patient who is a long-term smoker, because of the greyness of their skin, because they're not getting good circulation. And when you don't, your circulatory force is in the dermis. So the dermis is responsible for supplying all the nutrients to your epidermis. So hence, if you've compromised blood supply in your dermis, you will not have good nutrients to your epidermis. And hence, plastic surgeons would never operate on somebody
And you know
who
why
is
I
a
know
You've been
smoker.
told.
Sorry, guys. I'm not, and why is that? Because your healing is compromised because you don't have good vascular supply to your scars.
I know. I've been thinking about it. When I'm in the market for the facelift and the boob job, I'll quit a few months before.
No, not work.
Doesn't work like that.
No, does it not?
Unfortunately not.
In all seriousness, though, is smoking not reversible? But say I was to quit now, how long would it take to slowly go back again?
The interesting thing, how long have you been smoking?
Not too long. 15
And how
years?
many do you smoke?
On a good day, 20.
Do all you guys smoke?
No, listen, it's just me.
Oh,
It's just me.
oh.
But that's the only bad thing I do. I don't drink. I don't party anymore. You know, I live quite a healthy lifestyle, minus the early Marlboro.
Yeah, the thing is, it's just affecting your blood supplies. No, I can give you little solutions here. If you're using vitamin A, it's very good in angiogenesis and
Vitamin A?
Vitamin A. I'm not going into details here because I don't want to talk about any medication.
I will though.
And
So
prescription
retinols, it's
medication.
the things we talk about.
Yeah,
you know?
yeah.
Retinols,
Okay.
retinals, and then the prescription version of that.
Yeah.
Okay.
So this is where it helps help you have a sturdier blood supply. Also, vitamin C is a great help because, just give you a story. Remember when Columbus took all his sailors across the ocean to discover the Americas?
Oh, yes.
Which was ready, people were already living there. So he crossed the ocean in his La Niña, La Pinta, and La Santa Maria. I love that. But all the poor soldiers, when they got to islands or they discovered in America, all had scurvy. So this is why they discovered that vitamin C is very good, because what does scurvy mean? That your blood vessels, your teeth start to bleed, you're bleeding from the gums, etc., etc. That's because your vasculature is not healthy and it doesn't have enough collagen. So this is why vitamin C is very good at helping prevent a lot of telangiectasia in your skin, and it keeps your skin healthy. So when we talk about good vasculature, that's what you should be using in your skin if you're a smoker.
Well, no, because I keep seeing vitamin C across the board in everything. Everyone's saying that's like one of the best things for your skin.
The thing is, for acne patients, to be honest with you, I'm an acne patient. I suffer from lots of things, but the point is, using vitamin C for me, if I use it regularly, will congest your skin, and you never put it down to the use of the serum form of vitamin C. So that is an issue because sometimes the propylene glycols in the formulation can, over a period of time, about 6 to 8 months, cause that. When you put your fingers over your skin, you'll feel it a wee bit bumpy. This is where you never think it's the vitamin C that's the culprit in the form of serums. And that is actually, when you take that away, your skin is beautiful. Now, what kind of skin do you have? Yeah, I'm carrying out a consultation here, for God's sake.
That's what we need. This is the important
Yeah, no,
thing,
this
though.
is
Like
good.
you
What-
said, we say everyone should be using vitamin C, everyone should be using retinol, but that's not necessarily true
Not
because
necessarily
everyone's
true.
everyone's
Well,
so
no, to be
different.
honest, Mo's tried to get me to use a retinol, and I probably should. I haven't, however, yet. But I think,
tried.
considering I do smoke, my skin isn't bad, but I do look after it. Like, I'm very good.
Excuse me, define, look after it.
Well, no, we
Yeah.
have put you on a skin program. We've been shopping. We went
Yeah,
to Space
yeah,
NK.
yeah.
We did
Oh,
a
and
whole
I'm
shot.
very partial to Profilo. The fucking works,
We-
basically.
We love a little injectable, but sometimes you don't use the product you should always be using.
No, but actually
but somehow
recently-
you've got away with it, and I don't
Because
I
lo-
don't
no,
understand.
Hang on.
Because
what do
she
you mean
could
I've got
have
away
good
with it?
genetics. She could have good genetics.
She's
But
a
this is what
fantastic
I was going
genetic.
to ask you. Is skin generally quite a genetic? Is it your genetics?
Absolutely. Genetics plays a part in every skin type. Just like, for example, an acne patient, when they say, oh, I used to have acne when I was a young girl, I don't have it now. Well, sorry, my darling, but that's part of your DNA. And at some stage, it will come back under stress. When you get into perimenopause, you'll notice that your estrogen levels go down, and that's very protective with acne patients as well, understanding how everything works together, the physiology of the body.
What is classed
fascinating.
as an acne patient? Like someone who suffers long term with acne, or you went through a phase where you have it quite severely?
Normally it's adolescent acne, which people normally go through. Even eczema, a lot of these conditions you sort of grow out of.
Yeah.
The issue is coming into, for example, your menopause, and as you get older, when you go from your 40s, your immune response is compromised.
Right.
So let's suppose, just talk about acne. And I do find it amusing when I'm talking to people, I used to have acne, I don't have acne now. My acne's fine. Does anybody else in your family have acne? Oh yes, my brother has acne. The funny thing is when you're consulting with patients, they don't like to talk a lot about themselves. But by George, when you mention the family, they throw them under the bus. Oh, my brother's got acne, or my brother's got a big nose, he's got rosacea. So this is where you get lots of information out of your patient. But this is when you go into your perimenopause. This is where your immune response decreases. You have what you call immunosenescence. This is the marking of aging. So where your cells are not repairing as they should, and your immune system is not behaving as it should. So your DNA, the expression of reading the DNA is actually undermined. So this is where it comes out and hits you. I have patients, for example, that would be 50, 55, and they come out in psoriasis. Where did this come out of? And then you investigate, anybody else in the family has psoriasis? Oh yes, and it's all got to do about your immunocompromise.
I'm suddenly thinking family genetics, what's rolling
Oh,
around.
this is the first thing I always ask. Tell me about your family.
But with that, how much is that going to change over time? Is there anything she needs to be doing to prevent her going down that line?
You can, but I always talk a lot about when you're going into, everybody talks about perimenopause.
Well, no, because menopause is now. I mean, people do talk
How-
a lot
how
about
old are you?
it.
No.
31. If you
31.
say I'm about to head into it,
The thing
I'll
is,
lie to
the interesting thing is, I have 35-year-olds that have premature menopause.
fuck.
So
sorry.
do not turn that
But
off.
how? But okay. But the menopause as a whole is such a fascinating topic. But what can one really do? And actually, sorry. Firstly, how does one really know if you are suddenly prematurely going into menopause? Because that's crazy that someone 30 who's
I'll tell you how
35.
you know. You need to listen to your body. And women these days are so involved in looking after kids. They're doing, their careers, etc., etc.
Yeah.
You're not listening to your body. And what I talk about that is, you're well. When I talk to a patient, how are you feeling? As they used to say, how are you feeling in yourself?
Yeah.
So this is where, are you beginning to feel more anxious? How are you sleeping? Are you getting more irritable? Because most divorces happen between 40 and 50.
Really.
And this is because people are going through the perimenopause. And this is something that the NICE guidelines are taking more on board to actually address these issues. So when you're feeling anxious, etc., do you know what that's all due to? Your massive drop in progesterone. Progesterone is such an important hormone. It affects also your thyroid. So this is where you have less ability to repair. It affects what you call the conversion of T4 into T3. So when you don't have good thyroxine in your system, and that's all got to do with your nails, your hair, your skin, all of this you feel is affected. When you notice, you start paying attention to your body, you'll notice these things. Not being able to sleep at night, being irritable. Another aspect that is very interesting with regards to progesterone is when you have what you call an estrogen dominance. This is where your estrogen is still quite high and your progesterone falls. This is a massive impact in your thyroid, because your estrogen does not work very well with your thyroid, and it actually is very anti-thyroid. But your progesterone protects your thyroid and makes sure. So when we're talking about the essence, it's the balance between the progesterone and your estrogen is very important. Now, when I talk about inflammaging, you'd ask me to talk about that. The most important hormone in your body that is a massive anti-inflammatory is estrogen.
Yeah.
Okay? It is the most anti-inflammatory hormone that you have. And when you start to lose it, this is where you've got inflammation in your skin. And when you go to these symposiums across the world, what ages your skin and your body, you don't forget about this as well, is the fact that the increase in reactive oxygen species and increase in inflammation, which increases your risk of having cardiovascular disease, increases the aging of every organ in your body. The thing to imagine, I don't want to scare people when you, for example, when you talk about HRT in the industry, people are so scared of this.
But I think I mean, so menopause obviously is not something I've going through or considered, but you talk a lot to different people and everyone has a slight reaction differently to it. Like you hear these sort of crazy stories where women end up losing their fucking minds over it or getting told different things.
This is where I'll not go into details, but there's a very important way of introducing HRT in a very specific way. It has to be to do with your introduction of estrogen, your progesterone and your testosterone, because everybody just relates to one hormone or the other. For example, if you lose your uterus, they say you don't need progesterone. Well, that would be under a question a lot, and every menopausal expert will always have progesterone, because progesterone is not just about they call it the pregnancy hormone. It's important for lactation. But by George, we have progesterone receptors all over our body. And what was the divine reason for having progesterone receptors all over our body? So they have a lot more function as regarding to your sleepnesses, your irritability and things like that. So when I say people going into the perimenopause, noticing these changes, and how does your husband perceive you? Are you in a bad mood today? Does he have to sit at the side of the bed? I wonder how she's going to wake up today.
Do you think when you first notice signs of menopause, does it tend to be more mental signs or physical?
Initially, it's probably mental well-being, emotional well-being, which is important. Do you trigger off easily? Things like that, sleeplessness, and things like that.
And if that is happening, who should you see? Where should you go?
Well, normally GPs don't have a lot of time to deal with. So normally the pathway would normally be to go to your GP and get them to refer you to a menopausal expert, to be honest with you. Right. That would be the pathway, because otherwise, unless you want to pay lots of money through your menopausal expert, it's always, if you go that pathway, it'll always go back to the GP. So do you
think women should be having more blood tests and things like that to keep an eye on these? What's your thoughts on that?
The symptoms are the guidance, because having the blood test will not define how you're feeling. The blood test will not see fatigue.
Yes.
It will not say that you're irritable, that restless, etc., etc. So these are the signs that they're going to address in perimenopause.
And is it one of those things that you could, because I saw something the other day and it was saying how if you start taking certain things, whatever it is, supplements, medication, pre-getting menopause, the effects of menopause are a lot more subtle, whereas a lot of people tend to wait until they've got it.
I always suggest to people who don't initially want to start on officially HRT, they can go on to what you call phytoestrogens, like red clover, black cohosh. For example, red clover has about 10 times the phytoestrogenic quantities than edamame beans, which are soy.
Yeah.
These are very, very good. Also, you can start taking supplements with DHEAs in them, and you can get that through lots of health
Just on the high street.
On the high street. Now, the thing is about DHEAs, they can go either way. They're converted into estrogen or testosterone, and the body will dictate what it needs at the time. So these are nice little supplements to take to help you feel better.
Yeah.
Okay. Because I'm not the person, go to the GP and you're not feeling well, put you on antidepressants. That's not my focus at all.
No.
Yeah.
It wouldn't be that. I want to encourage your help out. It's all about elevating the levels of estrogen. So when you're in your menopause, theoretically, you will find your follicle stimulating hormone, which is telling that little gonad, which is your ovary, right, guys, you're not producing little eggs, so it's sending more and more of this follicle stimulating hormone to God. Will you release the eggs? Unfortunately, when you get to that stage, you've gone through all the symptoms, you're feeling terrible. This is and sometimes this is where even it's the symptoms that dictate when you're going to the doctor. And I can go through loads of symptoms like your hot flashes and things like that. I particularly had issues with my bones and my hands, and I felt very distressed with that because I don't like being sick. I'm one of those healthy people, thank goodness. So this is when I started taking HRT. I found it completely disappeared because you're reducing inflammation.
Right.
That's what the estrogen is doing, it's reducing the inflammation.
For the listeners, can you just explain what inflammation actually is? Because in my mind, I think most people just think swelling, right? But
Well,
what
I
actually
automatically
is,
did. After a heavy night, I used to look slightly inflamed.
very inflamed. So what actually is inflammation?
These are a massive onset of inflammatory cytokines that stay in your body.
Right.
And normally, when your body repairs, it goes through a period of inflammation, and that sets off all of these growth hormones, etc., that help repair the system, and then it goes back to normal. But when you have a massive increase in these cytokines, the residual level of inflammation is damaging to your whole body. Now, I remember somebody asked me a question. They were very fearful about taking HRT because in the early 2000s, they talked about, there was a report done with the Million Women Study and the Women Initiative, And this actually, I suppose, highlighted the fact that you could be more prone to cardiovascular disease and breast cancer. Now, at this stage, when this happened, now this is in the early 2000s, women were already taking HRT, but they were so scared, and the scaremongering, that actually the prescription rate of prescribing these HRT dropped by more than 50% in 2 or 3 years. Then they did looked back at the study and the weaknesses of the study, and this is where they highlighted, they reassessed how the study was conducted, and this is where even the regulatory commissions would come on here and said, this is not really the best way to go, but it's taken women so long to get back to HRT. And I'm going to explain something very, very important, and how important estrogen is in 2 aspects. 3% of women over the age of 60 die of breast cancer. What percentage of the population die of cardiovascular disease? It's 30 to 40%. So if you were battling a decision, do I want to go on HRT or do I worry about, so what are your odds if you're betting on a horse? What would you go for? I want to go on HRT. Okay? Yeah. And this is where, it stops a lot of elastosis in the skin, your skin. So I remember my husband used to say to me, all of these creams are a waste of time. I went on the HRT when I was talking about Obagi, your vitamin A's, etc., etc. Then he's looking at me now compared to my peers, and he said, "Holy God, they're looking so bad, Mary." And he grabs my hand and gives me a little kiss.
Does he still do that?
He does that. He did that last week. Yeah, last week.
Was it once a week thing?
No, it was just at an event he was there at. So. Yeah.
It's fascinating. It is interesting because I think for something like social media, you get to see a hell of a lot of different things. But do you think there's an impact on that scares people?
Do you know, I think people are like lemmings. Anything shiny, they're all like lemons to the slaughter, and they will all fall over the cliff together.
Yeah.
So there's not a lot of scientific evidence in the thought patterns of a lot of, so people have to be educated, to be honest with you. Education is the prime, this is the focus that will lead people into choosing what medication is best for them, because unfortunately, even, you know, as a pharmacist prescriber, you know, I'm always evaluating people's medication and assessing, look, we need to drop this, etc., etc. So it's very, very important.
But the trouble with that is there's just everyone educating now. Everyone online becomes
But
an educator.
everybody
Every
who has a
influencer is an
voice
educator.
educates, and it's complete rubbish when you
I
see.
have learned a useless amount of information on going on Instagram from
Yeah.
people that I feel should actually be reported.
That's the problem, that no one regulates it. So you get given all this information about HRT, cancer, and all these things.
But isn't that mental? Like, how is that?
Crazy.
But then the problem is you get some idiot like me who watches it and goes, well, that's legit. I'm going to do what they're saying.
That's the problem. You're the problem.
How dare you? I educate people on lubricant, and I have to say,
You do.
I create lube, and actually, a lot of it is aimed at women who are suffering with or going through menopause. That's what
But
we
you see,
started.
it's not the messiest thing either.
What
ever.
lube? That's
Lube.
filthy.
You
Why
haven't tried
on
Liv's
earth-
one yet?
Sorry, why on earth would you go through that?
Can I tell you something?
Can you? It's local as well. It's not helping. Do you know estrogen is helping your cognitive ability? Just let me go through about estrogen as a very good anti-inflammatory hormone. It's helping your cognitive ability. It's very much in your short-term memory and your visual memory. Like, for what's your visual memory? Oh, I saw the keys 2 minutes ago, or where were they? That's your visual memory. Short-term memory, if you say to me something, 10 minutes ago, what did I say? Also, testosterone is very good for that. But estrogen, and this is what I worry about, because I don't only talk about perimenopause, I talk about menopause and postmenopause, which nobody is talking about. How are you going to be healthy in your older age? This is why estrogen is the main hormone that stimulates what you call osteoblasts to create healthy bone.
Yeah.
So when you're thinking about your mother, for example, and she has a fall and she has got osteoporosis, her chances of good recovery are not good. If she's on a good level of, and people say, Mary, will you ever stop taking HRT? No, they'll bury me in my day. My hands will be completely covered, my chest. Isn't she a good looking woman? She's looking good, bones and all. So this is where it's very important. How are you going to approach your golden years?
Yeah.
So think of it in a long-term pattern. So
Because the other thing that always pops up is the exercise that women should do when they go through menopause, and it's more about like weight training rather than doing long walks. And
because remember, collagen, I get back to collagen, for example, estrogen again is the main hormone that stimulates the fibroblasts to produce collagen, elastin and gags. Collagen is very important for healing, one thing.
right.
It is very important with regards to your tendons, all your ligaments. People say to me, oh, Mary, how have you got such good bone structure? Because I haven't got angular sliding. I said, because I've got collagen that prevents reabsorption of the bone. If you don't have good collagen in your body, this is where it prevents bone resorption. So that is part of the aging process. Everything is connected to your estrogen.
So what are you doing to keep all your collagen? Tell the people.
Okay, what am I doing? I'm on HRT. I'm on estrogen, progesterone, and testosterone.
But what are the different forms of HRT?
So these are the three hormones you're dealing with. Estrogen,
Yeah.
progesterone, and testosterone are the three hormones that are important in HRT.
And women and testosterone. Talk to us about that, because
No, I'm not going to talk
sometimes
about. No, I'm going to.
we'll come to that story in a bit. But
What do
generally,
you mean?
women should be taking testosterone, because sometimes that's what people don't
testosterone is very
understand.
important as well, because the testosterone level stays quite stable. So the first hormone that you lose, the way they're all talking about cortisol at the moment. This is important. I'm going to
your
mention
stress
this.
level makes you gain
Now-
weight and all this bollocks.
When you're going from 40
Yeah.
to your 50 and your progesterone level drops, your cortisol level increases massively. So it's like that anxiety is all about cortisol. If you increase your levels of progesterone, you won't have problems with cortisol.
So it's basically just balancing out these
Simple.
factors and
They're
you feel
talking about all
fine.
these supplements and things like that. Assess yourself with hormones. Start with your hormones.
On that, your view on supplements, as you're someone who prescribes medication, what is your view? Are there any supplements out there that you think really do a job that could help level this stuff out, or is it very much more medication?
Do you know, one thing I would say, as you get older, your ability to absorb products because of your, what they call nutrient sensing in the lining, the little receptors that line the epithelial of the stomach are getting weaker and weaker. There's also a problem if you've got massive inflammation. Like, what's the core of good health? What do you put into your body? Do you eat a lot of, if you've got high inflammation in your gut, it's going to affect the absorption of a lot of products. So this is where the inflammagene process takes part. And this is where they do a lot of tests to see how much inflammation is in your gut. Because if you have a weak lining in your gut, all of these inflammatory markers like neurotoxins and things like that can slide out through the gut wall and cause a lot of inflammation. And remember, if you have a lot of inflammation in your body, your blood-brain barrier is weakened. So what's creating and causing dementia?
God, it's interesting.
Lots of things to be thinking about.
Because that's another thing. Gut health seems to be fucking everywhere. You can't look on Instagram without someone talking about their gut. And what is the link between that and like, I understand like a healthy gut, but what is...
Just, do you realise that you've 200 to 300 trillion microbes in the gut? And you've heard of, for example, the gut-brain axis, the gut-liver axis, the gut skin. It connects to every organ in your body. And through the vagal connection to your brain, this is where you can have issues with dementia. You can have exacerbated influences with regard to schizophrenia. All of these diseases are can be alleviated. Remember, if you reduce the effects of inflammation in your gut, you reduce, for example, the severity of acne.
But how are we doing that? What are we doing?
Because how do you treat acne? The whole focus is not in treating acne is not just so much about treating the microbes. It's more about treating the inflammation. So how you feed. This is where, for example, young girls that I treat, for example, for acne, they're perfect when they're home during the summer. They go to university. They're eating a lot of rubbish. They're just having a great time, and the acne comes back. So inflammation does play a part in the severity. It's the world of epigenetics. How you lead your life will influence, regardless of your DNA proclivity to have a lot of eczema, etc. You can reduce your eczema by influencing how you eat and reducing the inflammation in your stomach, your gut.
It is interesting.
It's fascinating. And you can get the inflammation. This is what you all should be doing. Is my gut inflamed? Do your
how would one know if your gut is inflamed?
There's a test for that, yeah.
Okay, fine.
You can test, there's a test for that. So you can check the bacterial load. And the whole idea is it's not about the amount of bacteria, it's the diversity of the bacteria in your gut that will indicate a lot of inflammation. Now, when you go through what you have for breakfast in the morning, if you eat a lot of processed foods, that's really bad for your gut, not healthy. Not having a healthy diet from that point of view. So
from that point of view, I think you're fine.
I'll be honest. This is my problem. Is the sugar, and the only time I've never suffered badly with acne. I have siblings who both. I'm one of 5. 2 of them have gone on Roaccutane for acne, so it was severe. Me and the other 3 haven't. But
it's in your DNA.
But it's in my DNA. So I'm assuming is it going to suddenly crop up and smack me at some point?
It could crop. For example, when you go into your menopause, you might have breakouts.
Oh, fucking brilliant!
Yeah, because your immune system isn't as bad, and it's reading your genetic code, and this is where you can. But if you have a good lifestyle, like an epigenetics, looking after your weight, etc., because BMI increases inflammatory markers. Yeah. All of these metabolic disorders, like diabetes and things like that. Are all influenced by that. But
what about like hormonal acne?
Hormonal acne, it's funny because when you start your menstrual cycle, the first 14 days would include your period of bleeding. After that, you have a very high level of estrogen, which is very protective against your acne. But as your estrogen falls and what they call the luteinizing hormone increases, that is a message to your body to release the egg. And what does Mother Nature do as a wonderful gesture? It has a massive little release of testosterone to increase your libido to make sure that little egg is fertilized, by George. So I always say to my acne patients...
around the time of your...
So this is why I say about 1 week before your ovulation, just hype up your medication with regards to what your program you're on for treating acne, which is great.
Going back to hormones, you were saying about how divorce rates are a lot higher
Yeah.
because the men are complaining about the women. But let's
And that's
go
why
back.
it's very important to educate men on what is happening
But what
to
about
their
the
wife.
other way around?
They've
Because
got menopause, I'm telling you right now.
What's happening
And
with
They
men?
retire and become lazy fucks,
Yeah.
if I'm totally honest with you.
What's happening with men's hormones, and when does their menopause
I
start?
am being led down a path
You are being
Tell
done.
us, Mary.
because if my husband listens to this,
We'll block him. Don't worry.
let me explain how testosterone work in women. It's a better
Yeah.
story. So women generally release about 100 to 400 micrograms of testosterone on a daily basis. It's absorbed by the sex hormone binding globulin. 80% of the testosterone is absorbed by that. 19% is absorbed by albumin, so that you have 1% that runs freely, which is affecting the androgenicity of the blood. Okay, it's the uncleaved, unfractionated part of the testosterone. Now, people that have acne means that their levels sometimes of that hormone, the sex hormone binding globulin, is a lot lower. What heightens that to make sure everything is absorbed is your estrogen. Okay, this is why they give some women certain forms of estrogen to help protect against that. You have diseases that affect that level. So this is very, very important to help with that sex hormone binding globulin. So the question you were asking me, I've sort of lost the train of thought here.
So have I. I was thinking. I was just thinking how ghastly a word globulin is. I was like, that's.
We're
really-
going to have testosterone.
Yeah.
So when I talk about the importance of testosterone, it's very important from the point of view of your mood.
Yeah.
I have women, for example, that are just taking estrogen and progesterone and are not thinking about testosterone. Testosterone is very important in your mood. It's very important in building up your muscle mass, because as you get older, you need testosterone, okay, to convert make sure that you're taking a good form of protein. I'm not going to go against one, because vegan protein is very good with your products there. So it helps to convert that protein into muscle.
Right.
So I have a lot of friends who would be very athletic. They have no fat on their body. Their face is they find it very difficult to build up muscle. And this is because they don't believe in HRT at all. And as your testosterone is decreasing, you don't have that ability to build up good muscle mass. So muscle and bone mass are very, very important as well. There's not only estrogen that's building up your bone mass, it is testosterone that is building up your bone mass.
And how are all these
And
things
it's also
affecting?
very important for your energy.
Yeah.
How about your
Testosterone's very-
hair? How's this all affecting
Yeah,
your
I
hair?
was
Because
going to
you've got
ask.
stunning hair.
But okay, so I went away recently. I met two women who've both gone through menopause. One had absolutely no symptoms, no side effects, whatever. The other one didn't go on HRT and ended up growing a shit ton of hair. If someone decides that you don't seem to have many symptoms of menopause,
Which you're one of the
in
lucky
the
ones, but you
meantime-
haven't got, just because you don't have the symptoms doesn't mean that
It won't come
postmenopause-
later.
Oh, it'll hit you.
It really.
Yeah, but
It's
the
because
bone-
but I think because one assumes if you're fine, you're like, well, I don't need it then.
That's interesting, because remember I said estrogen is very cardiovascular protector. They're going to have problems later on.
What are your views on the contraceptive pill?
The contraceptive pill, with the levels of estrogen you get in your contraceptive pill during your reproductive years, is a lot higher than the level of estrogen that you will get from HRT to start off with. So just to give you an idea, when women go on the contraceptive pill, it's a good level of estrogen. And sometimes I say to people that are on the contraceptive pill that have acne, don't necessarily come off it, because you'll find that your acne may be,
I see that a lot.
absolutely. So it's not something that I encourage, and I advise my patients that are acne patients that are on the contraceptive pill to stay on it, because I'm thinking of all the aspects of estrogen that are protective,
Right.
Even up to the age of 40, 45 or whatever. And then you're going on to an HRT, which is a lower level.
So I went on the pill and it made my hair fall out. So what overload of hormone would I have been having?
It's the progesterone that is making your hair fall out. So if this is where it's all got to do with the luteinizing hormone. So you find women who have given birth. Have you children?
No.
Oh, just ask.
Close for business on that front, let me tell you.
So you still have quite a high level of estrogen when you give birth, but your progesterone is very low, and this is where you have hair loss at that period of time. So I
Yeah.
don't want to go through a whole consultation with you to investigate it.
No, I just
You
couldn't
might
possibly
want to
lose any more
You might
hair.
want to have all of this there on the air.
No, I went on Yasmin, and I had no idea that
Yasmin
was a
is very good
potential
for,
side effect. Well, at the time, I suddenly had bald patches, and I was like, hang on. And the doctor said, what have you changed recently? I said, well, I've been on the pill for 3 months. And they said 1 in sort of 500 can get
Well,
hair
there could be
loss.
side effects, yeah.
Oh, yeah.
With going back to acne and contraceptive pill, but what if people come off it to then start a family? What should they be doing to prevent the acne?
Well, do you know, this is where you just use, do you know what I always say to people? An acne patient has, this is where the pH of the skin is very important. Acne patients tend to have a higher pH of the skin, so I always suggest them to use more acidic cleansers. Like, for example, what we have in the Obagi range would be the Cleansiderm wash. But I always talk, it's not a glycolic wash that we use, even though it's more acidic, it's a salicylic acid. Now, why do I always choose salicylic acid? Glycolic acid is a nice exfoliating cleanser, but what it doesn't do, it's not an anti-inflammatory, whereas a salicylic acid a cleanser used in the right way, massaged all over the skin, leave it for a period of time and wash off, will help you reduce the pH of your skin immensely. And that's where the key factor, because you have lots of little microorganisms on the skin that if you pull them out of their natural pH tend to be more pathogenic and they proliferate. So keeping the pH of your skin from that point of view could be a very simple way of doing it as well.
So acne patient, salicylic acid is very
Salicylic acid,
important.
oh, absolutely.
That's what we pushed.
Keep in mind, salicylic acid is also lipid soluble, whereas glycolic acid has no aspect of lipid solubility. It's always water soluble. So it's not the go-to. If I went into a clinic and they were doing peels, for example, that said glycolic acid, I'd walk right out. Yeah. I'm sorry, these guys don't know what they're doing.
So that's why
That's
then
the
we
same with the cleanser.
we use those on where we use the salicylic acid wash, the salicylic toners, and that really calms acne down.
Yeah, absolutely. Phenomenal.
So we've talked loads about acne. Let's move a little bit onto pigmentation, because I know this is that's your love.
Well, the other thing afterwards, can we talk about libido and the vagina?
Please.
Well, let's
That
talk
sounds a
about-
lot more exciting.
Now, thing is, I'm not really into using a lot of these products in the body because it's a very high maintenance, to be honest with you.
What's this for? Pigmentation?
For pigmentation. And basically, the essence, as we say in pigmentation, is all around tyrosinase inhibitors, vitamin A, and an exfoliant. That's your key, that's your pyramid of use, and you have to be using all three together. So this is where in Obagi we use the Nuderm FX system. And it's an excellent, you should see the results before. I'm so
It is
passionate.
incredible.
Really?
I am so
Incredible
passionate
results.
about this because until you've been on that journey, you have no idea of what you can achieve. Oh, it's phenomenal. That's why I'm so passionate about it. And if I'm not passionate about something, I can't talk about it. The girls know me.
Yeah.
We know
It's
very
just-
well.
Yeah, oh God.
So if you've got pigmentation, the 3 key ingredients are,
Tyrosinase inhibitor,
yes,
a vitamin A, and an exfoliant.
and in English, I'll tell you what that means.
I was about to say, I could barely consider spelling that.
So things like hydroquinone, or in the non-prescription version, things like arbutin will help to reduce your pigmentation. So that's the
So
tyrosinase
how they
inhibitor.
work a tyrosinase inhibitor is that they regulate, no matter where the stimulus is coming from. It could be from the sunlight. It could be drugs that you take that stimulate inflammation. A lot of drugs stimulate inflammation, and inflammation stimulates the pigment. It could be, for example, hormones such as estrogen, progesterone. It could be cortisol that stimulates pigmentation. No, regardless where the trigger comes from, the use of tyrosinase inhibitors is to regulate how these little pigment cells, which are called the melanocytes, produce pigment. And it's not as if we do not want to stop that, because this pigment called melanin is very important in protecting, sitting over the nucleus of the cells, protecting your DNA. So it's a tyrosinase inhibitor. It regulates that lovely blending production of pigment in your skin. Of course, you have to use it with an SPF as well.
Of course, SPF is
Yeah,
key.
yeah,
Without
absolutely.
SPF, there's no point doing
Yeah,
any of these
you have
things.
to, yeah.
The way I explain it to my patients in terms of pigmentation,
I do use SPF, if you don't mind now. Thank you. Motox took me
you
straight
do.
into Space NK.
That's the
and
first place we
put
went
it
into.
on.
Got you some SPF. So the way I explain pigmentation to my patients, if we're going to treat it, is one, we reduce how much pigment your cells are producing. So that comes from the inhibitors. And then number two, we're exfoliating. So we're removing all the damaged cells that have already been produced and therefore pigmented. And then we use the vitamin A just to calm things down. And
Well, vitamin A is multifunctional here because vitamin A will keep you young forever, but it's how you harness vitamin A is very important. But the focus in pigmentation is it stimulates the turnover, so it speeds up the movement of your skin cells to the surface, and you need the exfoliant, so you have a beautiful feedback. So that's one aspect of vitamin A, but vitamin A has multifunctional. It reduces the inflammation in your skin, so it reduces the aging.
And I know we're talking about this is mainly on your face, but can we use these products all over your body?
you can, but it is a maintenance, putting all those products head to toe.
But sort of what would you, because I mean, there's certain things I
I
would
would do face and neck.
Face and neck.
And décolleté.
What would you do for pigmentation on the body? Just don't get
now
it.
this
Wear
is
a full body stocking.
Now, it's interesting. There was a case recently of Fitzpatrick 5'6" who had pigmentation under her arms. Now, this is actually evident of a pre-diabetic patient, and this is where if they don't have their sugars under control, sugars are very inflammatory. And this is, I'm not going to treat you, you need to get your sugars under control. So, you know, when you talk about problems with metabolic disorders and things like that, they need to get that metabolic disorder sorted out before we go.
So it's finding the cause rather than putting
so
a load of
back,
creams on.
there's lots of things. You have, people think they have pigmentation and it may not necessarily be, because with 3 pigments in the skin, we have oxyhemoglobin, we have melanin, and we have a carotene. So when you're talking about these heterogenase inhibitors, they're only targeting the one kind of melanin. So there are patients that have hemochromatosis in Ireland, for example. People don't, that's the excess of iron in your blood. So you can see that pigment. And this is where I teach people, look, is it pigment that I can address? Or is it a pigment I have to send you for phlebotomies, or like Addison's disease, Cushing's disease? All of these are producing other kinds of pigment. And this is where they have to be sent to the endocrinologist.
It's not always sun damage.
Yeah, you have
we
to.
We did actually have a question from a
someone.
viewer.
I was just quickly, my brain just suddenly thought of something. Have you got many patients who have come to you on Ozempic?
Yeah, you lose a lot of muscle mass.
Is that because that's one of the biggest things for it, isn't it? And also,
you see, a lot of your energy is stored in your muscle.
Yeah.
Stored in your fat. So it's important to understand that. But you have to be doing, this is what a lot of people are not doing with Ozempic. They're not doing the lifestyle. They are not going to the gym. They're not doing the rest.
They just rely on the injection.
They're doing a quick fix.
Yeah.
So I've no sympathy for them.
No.
Whatsoever.
No,
they should be going to the gym.
I think it's a mental thing, and I only say this because when we spoke about it, people messaged me asking about it. Don't ask me about Ozempic. I've got no fucking idea, to be honest with you. But I think it's a mental thing, because you're not actually changing anything. You're just starving yourself.
Well, no, you're changing a lot of things because you're targeting the reward center in the brain. So,
but your habits aren't changing. You're still shit just once a day rather than 3
times. You see, when you dull the reward center in your brain, because this is why people say when I go on these drugs, for example, for GLP-1 agonists, I'll get myself out of a lot of bother there. GLP-1 agonists, you are dulling the reward center, so they're going to be using these in the future to reduce addiction, smoking. All of these things, which is fantastic. Because
actually, is a side effect of quit smoking?
There we go.
Of what?
Where we should get you on.
Alcoholic addictions, all of these things. So the whole future of these in different doses will be used for addiction, because it's dulling the what you call the nucleus oh my goodness, I can't remember the name of it now.
We have discussed it before. The GLP-1s are amazing. They're changing lives, but you do see huge changes within your skin, your hair, your muscle mass.
Ozempic face.
The Ozempic face.
Think of it. Why is it helping your acne? Why is it helping your skin in general? Yeah. Because it's anti-inflammatory. Back to the same. Inflammation is the source of everything that's going on. Aging, the whole thing.
It's the devil. We had a question about pigmentation from someone.
We've had a question come in about pigmentation. Please help. My husband and I ordered your lube recently. This to do with pigmentation? Ordered your lube recently. We decided to put it to the test. It was going so well. However, at one point, he abruptly stopped and asked if I was growing a moustache. Of course, I immediately leapt off the bed to assess my upper lip. Sorry, I suddenly thought, wait, is my lube helping hair growth? Sorry, I seem to have developed dark skin pigmentation, which looks like I'm raising money for Movember. What on earth is going on? Firstly, thank you for using the lube. This is not to do with my lube.
This is
right?
nothing to do with the lube.
Nothing to do with my lube.
So I think the question is based around people getting pigmentation on their upper lip.
Yeah, so they're using something in the skin. Back to the same old story. Inflammation in your skin will lead to pigmentation. So what is inflaming his lip? What is he using?
Her lip.
Her lip. Is it wax removal
Ah.
that is causing inflammation? And this happens a lot with women who are using wax. It causes a lot of inflammation in the process of using, so that will lead to pigmentation. Always keep the connect as inflammation can lead to pigmentation. So you have to ask the patient what they're doing in certain areas. Are they over exfoliating, which is leading to inflammation? Lots of things you have to consider.
So what would this lady do to reduce or to remove that pigmentation?
Well, you know exactly what they have to do.
We do. 3 things.
3 things. Tyrosinase inhibitor,
Vitamin A.
Vitamin
and
A
exfoliant.
and exfoliant.
Yeah.
Done. It'll be
Simple.
gone in no time.
No more hairy lip for you, my friend.
Oh, no, it's not a hair.
No, it's not hairy lip. It's pigmented lip.
Oh, sorry, pigmented. How can one go and get their biological age tested?
We can sort one out for you.
Can we? I don't think I want to know.
Let's do one for the next episode.
Well, it's like somebody asked me the other day. I talk about shortening of telomeres because when your telomeres shorten...
What are your telomeres?
Your telomeres are little... connects to your chromosomes. So you have 23 pairs of chromosomes in the nucleus. And at the end, at the cap of every chromosome, you have got your telomeres, and they unwind every time a cell divides. They get shorter and shorter. So when your telomeres run out, you start to get a lot of mutation of your DNA, or you get a lot of senescence. So you can go to a lot of regenerative medicine consults, and they can actually measure your telomeres. Your telomeres. This is interesting because I said, I've no interest. I don't want to see how long I've left at this stage.
Like when is the end?
Yeah. When am I going to run out? Okay.
Should we go back to your vagina and your libido?
Oh, yeah, no. So, I created a lube. Anyway, our sort of biggest market, not intentionally, but is women who go through menopause. What is it's due to lack of estrogen, isn't it, that one doesn't produce enough natural lubrication
So
down
what
there?
happens is that the endothelial cells, not over your vagina, your bladder and your urethra, change. They tend to be more, I suppose, more higher pH. So that will lead to more bacterial growth. And it's also the lack of estrogen makes it very dry. So this is where what brings a patient to the doctor would be painful intercourse, where your vagina is so dry that you can't have, do your duties to your husband with your husband, so to put it. And this is when I was just looking at some Pakistani clinical journals there about the stigma attached to women going into their menopause. They feel very oppressed because it's a very patriarchal society, and you're supposed to be doing your duty. And of course, men run off in all different directions. So it's very intimidating, reach that state. And there's not a lot of understanding, and they don't like to go to their doctors. So it's a very difficult thing. We don't realise how lucky we are. We can complain about everything in the UK, and we can go to our doctors and complain and this sort of thing.
Quite isolating, actually, I've just
Yeah,
realised.
and I think it's a very messy approach. I think you should be addressing at least your estrogen and progesterone at that stage, and it'll also help. Will reduce the cortisol aspect when you're putting progesterone into your system as well as the thyroid. This is where you lose energy. You feel lots of things like that.
But not that I'm taking down a path, but should men also be taking testosterone? And
They
at what
should.
point?
They should.
At what point should they be doing that?
So I get out of bed like a bullet out of a gun in the morning. There's no keeping me back. And I remember my nephew said to me, "Oh my God, could you imagine Auntie Mary on the gear?" So I said, "Oh my God." But anyway, so as you can imagine, I can't afford to be on a lot of medication. So I just noticed that my husband was lagging behind somewhat. And he was very grumpy. I remember the old days, Victor Meldrew, have you heard of him?
Yeah.
Grumpy old man. That's what, So it is funny. I said, right, Michael, we have to get you to the GP. So he went to the GP. The levels of his thyroid were fine, of his testosterone were fine. And then this is where I question this fine analysis when you're going through the blood tests and things like that. So I just immediately sent him off to an endocrinologist this stage, and he was put on thyroid medication, and he was put on testosterone. Now, all I was thinking about is I just want the bad mood, can't stand it, no time for it. Just want his energy back. I just wanted my husband to be back to the vital person he used to be. And even the arguments had subsided at that stage. I thought there's no fun. I've lost the fun of my husband. So the aspect which I actually didn't take into consideration was the libido. So I thought I was doing quite well at that stage. And here he is crawling across the bed and I says, holy cow. And this is where you get that alpha male coming back, where the sheets are awoken in the morning. And this is where, all the fun begins. But this is where, when I inject him, it's been a bit of a torture. When I inject him at this stage, I think, maybe a little bit less. But it is fun. It's made a massive difference. Men should be, because they go through hypogonadism.
But you don't
as well.
hear about this ever. You never
This is
hear
the
men.
thing. This is why I think it's quite important.
So it's
I
not
think my
only
father
women
could do
that
with a
go
good
through
poking or whatever it is.
hypogonadism, as in their ovaries are producing less hormones. It's that men go through hypogonadism, where their little testes are producing less testosterone. So this is a very important thing for men in the aging, health of bones and mood and everything like that. So it is very, very important.
So wait, what's the one thing that's could get your libido back? That could just help?
I told you,
That, just,
testosterone.
but for men and for women.
Testosterone.
Testosterone.
So, yeah, because it's also testosterone is very important for your urogenital health. It's important for your metabolic health, how your fat is distributed as well. It's very important for your cognitive health, your libido. This is where people aren't adding it on to their estrogen and progesterone is a big mistake.
At what stage so there's loads of female listeners on the pod. At what stage should they be
Considering it.
harassing their partners to be seeing someone about testosterone? What are they looking out for? What are the signs and symptoms?
When he's leaving them alone. Now, some women are saying he's no bother to me at all, which they could be very happy with. So leave things well enough alone. So it depends what you're looking for. But I mean, if you want it for the health and well-being of your husband, I think it's very important to. Now, are you on testosterone?
I'm not. I think I'm full of it. I'm joking.
But and for women for perimenopause stuff, when should they consider thinking about looking into anything? I mean, it's only because I've just had
It's
a
your
fertility
symptoms
expert
that guide you.
Symptoms. I've just
Listen
told
to your
them
body.
to freeze my eggs. Now I'm telling them to unfreeze them. I don't.
And the thing is, in the future, it's not just about freezing your eggs. You should freeze your stem cells. That's the
Really?
future.
And how are we doing
Freezing
that? What are we
my
doing?
Well, this is why wake up. Where's all our scientific
Where are they?
brains here? Freezing your stem cells, because that means you can regenerate a heart, maybe, or whatever. What's going on?
Freezing our stem cells.
This will be the future of medicine.
That's what I was going to ask you about, something else, which I've seen a lot about peptides.
Yeah.
And injecting them. There's studies going on.
There's lots of peptides here. So what peptides?
Well,
are
because
You tell us. What's going on?
No, because apparently it's crazy in China, but it's almost like because we started talking about it.
We were talking
but
about
things that
peptides
can
and
help with
stuff.
hair loss, muscle stuff, like a range of different things.
The thing is, peptides are a series of, you've got a chain of amino acids, and when you peptides, you have over 10 to 50 amino acids. That's called a peptide. So peptides have so many different amino acids there. So peptides can vary. There is a multitude of peptides. So when you ask me, but it's very difficult to have this conversation on peptides. I need to know what's in the peptides
don't
and
know.
what they're doing. What is the mission?
Well,
What
this
is
just
the
seems-
message?
So what is coming in the future? So we were talking about potentially stem cell freezing and peptides. That seems to be what everyone's talking about. All the skincare companies
But
are adding
the clever
peptides.
thing about stem cell, if you've got a stem cell and you put it in any part of the body, it will
Yes.
regenerate from there. So I think that is the future of medicine. Peptides, they will stimulate peptides if necessary, and
So we
Yes,
need to
it
find
is.
someone to freeze our stem cells.
well, who's doing that?
Someone
I'll
probably
tell
Kim
you-
K knows.
I'll tell you why that comes from, because a lot of people in the industry are sort of doing autological fat transfers, where they're using stem cells from your fat, mesenchymal cells. and they're injecting it as fillers. Now, if you are, this is very good where you can put stem cells into an area where you've had an accident and things like that to help regenerate. Yes. It's really, in your face and things like that, which are wonderful. But as you get older, those stem cells are exhausted, just like with PRP. What in God's name are you going to do? For example, if a 70-year-old, you're going to say, oh, I'm going to inject your stem cells. They're no use. So people fall for that all the time. Don't fall for that. You have, if I had my young stem cells when I was 20 frozen there.
So what you're saying, if I was going to do, say I started to lose a load of weight in my face in like 20 years time, not to inject my own fat back into it.
Yeah.
That's
now,
interesting.
for example, if you're 60 or 70, it's not going to be the same. If you're a young person, yes, it will be a value, but your stem cells...
See, I'm now caring more about the way I look than freezing my eggs. I'm freezing my stem cells.
This is just
bothered by the eggs,
this is something that I've thrown out there for people.
But that is the treatment that Kim K did have
Unfortunately.
recently,
Stem cell.
where they took her stem cell. No, I think they took someone else's stem cells and injected it into her, didn't they?
Right, next time you've got a healthy patient in, let me know. I'm coming round.
Well,
freeze their stem cells.
nick their stem cells. Right, so we're going to talk about a few products that you love. We do a little thing where we do like product of the week or the month. Is there any products that are highlighted to you at the moment that you love?
My passion is always around vitamin A.
I know it is.
And if you use a vitamin A, you always need to exfoliate. So this is the misconception in the market. I use my vitamin A, which pushes my skin cells to the surface. It helps to reduce inflammation in my skin.
Sorry,
So
should I be using vitamin A?
Yes.
Everybody
we've
should be
discussed
using
your
vitamin A.
retinols. Yes. Retinol, and then there's the prescription version.
Yeah.
So if there's one ingredient everyone should be using apart from SPF, it should be
Retinol. Retinol is, I can mention retinol.
You're allowed to say retinol.
Yeah,
And is there any in particular? Let me grab.
No, so this one here is a beautiful non-prescription ingredient that we have is vitamin A with an exfoliant. Now the exfoliant in this is polyhydroxy acid, which is a new exfoliant on the market. Polyhydroxy acid is a very big molecule that sits in the skin, is a very gentle exfoliant. So as I said, you always need to exfoliate the skin when you use a vitamin A. It gives that luminosity to your skin.
That's what gives the glow.
This is great. I always start using this about once or twice a week. I always tell people low and slow with retinol. So this is the problem. People are using it and trying to get quick fixes out of things. You have to condition your skin. So 2 or 3 times a week, you use this. It's 2-in-1 products. So it has the fabulous PHA and the retinol, and then use in the morning your vitamin C, your beautiful hydrations, SPF, etc., etc. So this is a fantastic little product.
You should need to put this to your routine. There you go.
No, so what? This 2 to 3 times a week
So
in the
initially
evening.
you would start.
No, a week. No, 2 or 3 times.
2 times a week, and then you would slowly increase that, right?
Yeah. Oh, absolutely.
As much,
To every day.
as much as you can. Yeah, absolutely. But just start slow. This is the problem we have with vitamin A's and retinols. I get loads of people coming like, no, I'm allergic. My skin breaks out. I go dry, I go flaky. I'm like, no, you're not. You just use too high of a strength, too much.
Quick one. So I pop this puppy on. Any moisturizer, nothing. Just this in
Just
the evening.
this.
Just
You
this
don't
in the
need
evening.
it,
Can I keep this?
Yeah.
Oh, I'm going to
There you
start. I'll be glowing next week. Thank you.
So you would cleanse,
You would
tone.
cleanse,
Yeah,
tone,
then
put that on, and that's it.
That's it. You're done. That's all you need. See, we've
I
reduced
don't know.
your night care
I get
routine.
confused because I look at these people
'Cause
getting
there's too
ready for
much.
bed and the shedding that goes on, what they're doing. There's 25 fucking serums
too much
going
going
on.
on.
I think,
Do you know what I say in general? Every product you put in your skin has formulation issues.
Yeah.
So let's suppose, and they're adding too many ingredients in one product, and you don't know what's doing what. So
Yeah.
I don't like the difference between Obagi Medical and a lot of other skincares is that we're very focused on products that will make a difference. So we don't tend to blend a lot of. This is unique that we have this mixture of an exfoliant and the vitamin A in here. So remember, every product you put in your skin has formulation issues. The more products you put in your skin, the more irritation that you can cause, the more that you can lead to
Because that's what I
inflammation
never
and pigmentation.
understand is people putting like 5 different things on at night. And I'm
Less
like, the hell are
is
they all
more.
doing?
Less
is more.
Unless you've been
Absolutely.
put on a prescription
Yeah.
path by someone like me
pathway.
and Mary.
Yeah.
Like, for example,
Exactly.
the New Derm we were
That,
talking
even
about.
with those products, the formulation it's all sort of
works together.
synchronous. Yeah, it's all working together.
And we've talked about this before on the podcast where there's 3 main things that we recommend, right? So it's your vitamin C, your retinol, or your vitamin A, and then your sunscreen. Absolute basic key ingredients.
And when we can use vitamin C in the morning, it's anti-inflammatory.
There you go.
These are the key things. Vitamin C is
It's all adding
anti-inflammatory.
up.
Vitamin A is anti-inflammatory. Initially, it causes inflammation, but over a period of time, it's the one thing that they use in dermatology clinics that controls inflammation. So they use it in conjunction with psoriasis medication, in conjunction with rosacea medication. That is the go-to that they use in
everyone.
combination. Yeah. So initially, it causes inflammation, but it's the one thing that controls it.
So how long should I use that until I increase the sort of dosage? One would
See
say?
how you feel. The older you get, you need to pop it up into prescription medication.
So once you get through that, later on, or especially when people have problematic skin, they come to see someone like me and Mary, we might put you on a prescription version of this, of the vitamin A.
Okay.
Which
And
Over
gradually,
the years or
it's
something.
always low and slow, and you're only going to get older. And of course, at your age, you can never see yourself in.
We'll never let that happen.
I'm sort
you're
of hoping
50.
some sort of injection comes up.
Don't
by
worry,
that
we'll
point. Yeah. We just-
what about hair? Any hair products?
Oh yes, fabulous! We've got this new product that's come
It's
up.
fantastic.
Is it? I need
Very
to try
good.
this.
You
yeah.
sell it's BioStem Scalp. So this is, for example, a lot of young people are pulling. Could you hold that for me?
Of course I will.
Because I need my hands. So you have young people pulling their hair back, constantly putting stress on their hair. So you find weakness of the follicles here. And as you age, you get weakness. So I'm putting it along here and along these wee furry parts that I have here. So
Right in the
not a
front.
lot, right in front. So we have a lot of people that are doing studies on it at the moment. I only started yesterday, so I can't give you a lot of information, but it's doing very, very well.
Really?
They have great studies on this for men and hair growth. So, this will be used. You go to your trichologist, they do a CO2 therapy, PRP therapy, lots of injections that they put in of vitamins. But between those sessions with your trichologist,
Yes.
this is the thing they should
But
be
why
using.
is
fantastic.
it recently hair loss is becoming a much bigger thing, and it seems to
Oh,
be
yeah.
very commonplace amongst a lot of people, whether it's long COVID, menopause, post-pregnant, like loads of
Ozempic.
different things. It is.
So, for example, in the eyelashes, in older women, for example, your anagen phase gets shorter, as again.
What does that mean in English?
The growth phase of your hair, because you go through several phases of hair growth.
Yeah.
So the anagen is very important because that indicates how long your hair will grow. If it gets shorter, then it's telling the hair growth, that message, grow for a shorter period of time. So this is where we brought up, based on the success of our New-Sil lash and our New-Sil brow, we brought out the scalp serum as well, so which is phenomenally good. So I found as you get older, the eyelashes were getting very weak, and now my sister was sitting beside me the other day, and she said, "Mary, are you using false eyelashes?" I said, "I am not." So this is what I'm using. It stimulates that hair growth. It's great. Be careful not to go over the border with your eyebrows, because the hairs start growing here. And there's some people are saying, "My God,
I
didn't
see that
realize-"
so much in
Oh
clinic.
no, it's a test.
No, I bloody
So
had
you
that.
have
I
to
had
really
I
go
had
regular
furry
every 2
under
weeks.
eyes. What the
You
hell
had furry
is
under
this?
eyes because you were using
And
lash
I
growth
was
serums.
like, yeah, no, I know. I've stopped all that now.
So you got to make sure when you're putting this on, you
It's
put it at the
just the
tip of the lash
lashes,
and
yeah.
just let it seep down into the base.
And
Don't
make
get
sure
it anywhere else.
that you wipe, because sometimes if you think, again, we're always in a rush. We think using more would
Yeah.
be better. It can irritate your eyes if you put too much, and be careful with patients who are putting products on for glaucoma. You cannot use this. Okay, these are concerns. Yeah, but
But they
great
do
for
work
eyelashes.
beautifully.
Oh, beautifully.
If you want your lashes to
Absolutely.
grow, you need to be using that. Lash and brows. Mary, one last bit. Facials. What are your thoughts on facials, peels?
Oh, I love peels. Oh my goodness. Now people tend to use lasers these days more than peels. Peels for acne patients. We again back to our salicylic acid anti-inflammatory. I also use it for anti-aging. So these are peels you should be using regularly, every 4 weeks for older patients. I would say this is reducing a lot of inflammation and is helping with that turnover. Because remember, older skin cell. Take a 20-year-old. The turnover of their skin is 28 days. You go up to a 60-year-old, the turnover of their skin is 2 months. In that 2 months that is taking the cells to move from the basement membrane to exfoliate, you're trapping a lot of debris. And this is where it leads to a lot of inflammation. Also, you have the beginning of senescent cells in there. You need to get them out. And the actual rate of exfoliation is compromised as well. So this is why peels are so useful. as just for anti-aging. Never mind getting the skin cells. Absolutely.
So we're just
And
increasing how
declogging.
quickly those
Yes,
cells are
you're
coming
helping
through. The
your skin
quicker it is,
massive.
the healthier it looks.
The luminescence. I mean, I've got lots of older patients, 55, 60, whose skin looks brilliant. And they're not trying to hide away from their age. They just look magnificent for their age. And this is where, if you're not using, again, back to HRT, and you use fillers, people who are not using HRT, you notice that their fillers are coming forward on their face. If you do not have a good skeleton back to estrogen, okay, your fillers won't adhere well. You know, when you're doing your zygomatic arch and things like that, and there's not good adhesion, and all your facial ligaments and all of that carrying on. Oh my goodness,
This is fascinating.
Well, lasers and now, for example, if I have a patient who has dermal pigmentation that goes right down to the dermis, you'd have to use laser. Or very medium depth peels to get rid of that. I love using medium depth peels, but lasers, if you use them, will cause pigmentation. But you always have to work that with tyrosinase inhibitors, back to the same old story.
So normally we put
lasers
you on a plan.
Are always with a plan, and you need to go to professional people, because if you do a laser, which with lots of celebrities doing lasers, they went into clinics, and the post-inflammatory hyperpigmentation was horrendous. And I'm thinking, who assessed this patient? They did not know what they're doing. People are touching lasers and going in without professional guidance and how it's going to affect your skin long term. Yeah, so we get really good results. It's interesting.
We're going to do device last. What device did we do last time? Oh, we did the EMS device.
And you wearing Kim K's knickers.
And I was wearing Kim K's knickers on my face.
For show and tell this week, Dr. Motox has brought in... I mean, you're going to have to explain what this is. I have seen this everywhere on Instagram, by the way. Shark Beauty.
It is everywhere.
What is it?
So it is that's what they say. It's the first at-home facial device that does hydration, it does exfoliation, and it's got a dual heating cooling device. So it does not replace the kind of facials you would go and see a therapist for in terms of peels, facials, all that kind of stuff, but it's a lovely in-between at home where it just removes the top surface of dead debris, it washes the skin out, and it just gives you a little glow. The ingredients in here are salicylic acid, you'll be glad to hear, Mary, to reduce a little bit of inflammation, and hyaluronic acid. So it's literally just sucks all the gunk out from your face, and then you get a little gunk jar at the end, so you see all the horrible stuff.
I'm too
right
nervous with this sort of thing.
In what way?
What would come out?
Probably a Marlboro
cigarette box. That's what I mean. That's my concern. Just out of curiosity, quickly, because I know we've touched on this before.
Yes.
I've never had a peel. I've had one facial in my life. I know you say this.
It gives me a heart attack.
But why should I be having peels?
Of course, you should be having peels.
Come from the master herself.
Can I be honest? It looks like I sit on my ass. I don't know where I find the time to have these peels and stuff. I see some people.
What else are you doing?
I'm selling a fucking lubricant.
Yeah,
do you know how hard the lube business is? Yeah, okay, so take me, for example, right? I'm a smoker, pretty healthy, so I'm going to start on that. So what?
She's got no time.
Anti-inflammatory
don't
peels.
You take the piss.
Anti-inflammatory peels. Blue peel radiance every 4 weeks.
Every 4 weeks. Okay, fine. And can I get one of these with you, Mo?
Absolutely, yeah. So you can have the blue peel radiance, which is, I'm assuming, your favourite peel.
Yeah, it's one of my favourite peels. Let's suppose you're going to a party tonight, and you've been using these peels, and you're not allergic to aspirin or anything like that, no? No, okay, this is where I do the peel, and your skin will look flawless for tonight.
You will shine.
If you were going to any special event.
Okay, right, I need to. I think, I'll be honest, I always get nervous of the aftermath of things. Like, I get worried that I'll wake up and something's happened, or I'll get loads of acne.
Here she goes.
The nice thing about this peel, you probably 48 hours, you'll find a little bit of fluffiness around the lower face, but that's just hydration. It's not a downtime.
Okay.
It's not,
That day you will glow.
Really?
You will
absolutely.
Listen, with any treatments, there's a little bit of downtime. You might get a little bit of flakiness, but we want that. We want to exfoliate all that dead, horrible skin. No, I know, but I think what the thing is, I obviously on Instagram have seen so many. This is slightly different from a facial. I saw a girl who had microneedling, or what is it called, where you have the little dots all over. Yeah. They obviously put the needle in way too far. She had scarring for a year. And I was like, how is that fucking... But that's just done by people who haven't got a clue.
You shouldn't be going to people who are not qualified.
No, I know, but that's... I think I always get a bit scared sometimes.
This is the issue. It's the backstreet beauticians and the unregulation. That's all that's happened there.
Okay, so what's the difference between a beautician and someone like you? As in, how you'd obviously go to someone with a medical background.
He knows what he's doing.
No, I know he does. Of course he does. But How can you
but
look
we
at someone
also
who's offering
can't.
something and call them a liar?
Some beauticians, some estheticians, facialists are absolutely
Absolutely
fantastic.
brilliant, yeah.
They're better than what me and Mary could ever do in terms of for what they do. So you come and see me for more ablative stuff where we're doing the deep radio frequency microneedling and really causing quite a lot of damage to the skin. For facials and simple microneedling, I will send you to my facialist, Charlotte. That's who would do it because she's qualified in that and she's a million times better than me at that. So it's just
But
seeing
Charlotte
the right
is working under you.
Yes.
It's the difference between going
That's
to a
it.
therapist that is sort of
Everything's in a controlled
sort of
environment.
mentored by a
But we are good. We're
professional.
still going to do that thing. We're going to train you as an injector, aren't we? Which
People
is very
better watch
exciting.
out. Turn
Very
my house
exciting.
into
We're going to do a
jabbing place.
1-day course and make her an injector, give her a certificate. What do you think, Mary?
And what is she injecting?
Botox, fillers, you name it. And it's just to make a point, obviously. It's not. Unless you want to. Do you want to be a
Water
model? Do
here.
you want to be a model for that
No,
day?
thank you.
No, let's get one of my sisters in.
Yeah,
Oh,
great
my
idea.
Okay. Can I just say this has been absolutely fascinating, especially the menopause section, to be honest, because
Love
I
it.
think there's so much misinformation out there. So it's been interesting. So thank you so much. Also, can't wait to try this. I'm going to be looking younger, and I will quit smoking.
Amazing. And Mary, where do we find you? More importantly, where are you?
Where am I? Where?
Where do we find you? Where, if people want to come book in with you, see you.
I don't want anybody to book in with me. Thank you.
You're
I'm
not
not
leaving,
advertising
please.
myself whatsoever.
Mary is
And so-
fantastic. So you'll come and see me, and then I will message Mary about your concerns.
We are not being paid by Abaji. Mary is just a big fan of their brand, and that is why we were discussing it.